let's start looking at some of these procedures involving the skull bone or the cranium. So trephination and burr hole creation can be considered two terms for the same procedure. A hole is drilled or scraped into the skull, exposing the dura mater, and that's a tough outer membrane covering the brain. It's often done to relieve pressure or to help to create a bone flap in the craniotomy. Again, typically done in the OR under sterile conditions using a power tool. We do have some coding guidance around this, which tells us that if a craniotomy or a craniectomy is done, then the burr hole creation is not reported separately. And the NCCI policy manual states that a burr hole is separately reportable with another cranial procedure only if performed at a separate site unrelated to the cranial procedure, or at a separate patient encounter on the same date of service. So as you can see here, this provider is using a drill to create these burr holes, and from these he or she is able to create this, what we call a bone flap, if you can see that piece of skull that's been lifted out here. The other thing I want to point out is this dura mater that we're going to talk about in a second, and that's Latin for tough mother, and it's the outermost layer of our meninges, and it is tough, it's leather-like, but it's there to protect our brain. And you can see there's a picture there of the provider actually having to cut into the dura to get to that target tissue. And we're going to talk about that as we go through the webinar today.